If you're a cancer survivor and you've either had pelvic radiation or you have it as part of your upcoming treatment plan, this video is for you. I'm Dr. Alex Hill. I'm a board-certified physical therapist in women's health and oncology. And in this video, I'm going to discuss the importance of using vaginal dilators after pelvic radiation. This is the second video in my 3-part series about pelvic radiation. If you haven't watched my first video that goes into what pelvic radiation therapy is and the most common side effects, you can click the link in the description below or keep watching all the way to the end and it'll be one of the recommended videos. In this second video, I'm discussing when you should start using vaginal dilators, how to use them, and my go-to products for optimal recovery after your pelvic radiation. My next video, which will be the third video in this series, is going into rectal dilators and how to use these after pelvic radiation if you're having problems in the back door. But again, this second video, we're going through how to use a vaginal dilator if you have a vagina and you've had pelvic radiation. So after pelvic radiation therapy, the tissues and the muscles within the pelvis can become less elastic, dry, and can develop scarring and fibrosis, which makes the tissues very hard and inflexible. These tissue changes can make sexual activity painful or difficult, and can also make it difficult for your medical provider to perform medical examinations. So even if you aren't sexually active, it's still important to address the fibrosis that can develop after radiation therapy. This is where dilators come in. Vaginal dilators are small medical devices that are either used of a flexible silicone or a hard plastic. Let's look at the inside part of the pelvis. So the dilators help by working to mobilize and stretch the tissues that have been radiated. This helps to make intercourse more comfortable, but it also makes it easier for you and your medical providers to perform exams. Dilators are typically either soft silicone dilators like this or hard plastic ones. The dilator sets come with multiple sizes and graduated diameters for you to progress with. Many people only need to use 2 to 3 sizes of dilators, but if you have moderate or severe scarring or fibrosis, you may need a larger set to work from a small size up to those larger sizes until it's comfortable. All right, so let's talk about the 2 types. And first we'll talk about the silicone dilators. I recommend this dilator most often for people who need to work more on the superficial muscles and tissues, which are closer to the skin. So in other words, if you're having pain with initial penetration, either with sexual activity or with a pelvic exam, these outer muscles and tissues, that can be really helpful to use one of these silicone dilators. These silicone dilators are also good if you don't have fibrosis and you're just working to prevent it, or if you have very mild fibrosis. Silicone dilators are soft, smooth, and bendable, as you can see, but something to remember if you're using silicone dilators is that you need to use a water-based lubricant. If you use a silicone lubricant or an oil like coconut oil, the dilators can break down over time, which is no good. In terms of silicone dilator brands, my 2 favorite ones are from Intimate Rose and Soul Source. Intimate Rose also has this super handy dilator holder tool. So you see you can just hold it right here at the handle, and that makes it easier for you to reach down to get where you need to when you're using the dilator, especially if you have a hard time reaching down yourself just with your arms. The other type of dilators that you can get are the hard plastic dilators, and I recommend these for people who have moderate to severe fibrosis and scarring, and if you need to work more on the back part of the pelvic floor or improve the length of that vaginal canal. So this would be if you're having pain with deeper penetration, this would be helpful. Since these hard plastic ones don't bend like the silicone dilators, they can give a little bit more stretch to the tissues. So again, especially if you have more severe fibrosis or scarring, the hard plastic ones might be a better bet for you. Another good thing about this type of dilator is that you're not limited to the type of lubricant that you need to use. So you can use water, oil, silicone-based, whatever you want. All right, so now let's talk about when you can actually start using the dilator after radiation therapy. So you can often start using the dilator 2 to 6 weeks after your last radiation treatment, after that vaginal irritation has decreased and your medical provider has cleared you. For the first month, you can use the dilator 5 days a week. And then for the second to 6 months, you can use it 3 times per week. And after 6 months, you can use it 2 to 3 times a week. Most providers will recommend that you continue using the dilator lifelong, but just not every single day like you started out right after you finish treatment. Using the dilators consistently will help keep the vagina healthy and supple and not allow for that scarring to close in on itself. Before starting with your dilators, of course, always check with your medical provider. If dilators aren't used properly, they can cause more discomfort or problems. One other consideration is if you're cleared to be sexually active for penetrative sexual activity, then that can also count as one of the times of you using your dilator. All right, so let's go through the steps of how to use these dilators. Step 1 is wash your hands and wash the dilator. Just use a mild unscented soap and then towel dry it. Next, you're going to lie on your back with your knees bent and supported with pillows or rolled blankets. Try supporting yourself in a more upright or semi-reclined position with pillows behind your back to make it easier to reach and use the dilators. The key is to be as relaxed and comfortable as possible. Step 3 is apply a generous amount of lubricant at the vaginal opening and on the smallest dilator that you have. And don't forget, if your dilator is silicone, only use water-based lubricant. All right, next you're going to gently and slowly insert the dilator until you feel it stop at the back of the vaginal wall. You're going to use firm but gentle pressure, no forcing it. So sometimes gently rotating the dilator can help you kind of ease it in a little bit better. If there's no pain or resistance with inserting that smallest dilator, go ahead and use the next bigger size. And keep going until you get to the point where you feel a good stretch. So your starting size should be one where you feel a stretch, maybe a little discomfort, but no pain. So with your starting dilator, you're going to leave it in place for up to 15 to 20 minutes or however long your medical provider recommends. You can also stretch the bottom of the vaginal opening by moving it between 3 and 9 o'clock, kind of like a smiley face at the bottom of the vagina to help get a little bit more stretch if you're having some tightness at the vaginal opening. Once you're done, slowly remove the dilator, wash your hands and the dilator after you finish using it, dry it, and store it. It might take up to 8 to 12 weeks to feel an increase in the size of the vaginal opening and a softening of the tissues. At first, you might have a small amount of bleeding or spotting after using dilators. This is normal and it should stop as the vagina starts to stretch more easily. The spotting may also occur after using the dilator or after intercourse for a couple months. But heavy bleeding or excessive pain is not normal, and you should contact your medical provider if you experience any of those symptoms. It's recommended that you use the dilators, again, for the rest of your life, usually 2 to 3 times a week, kind of long term, to prevent any scarring or fibrosis that can happen after radiation therapy, because again, those tissue changes can continue to occur well beyond the time that you finish treatment. I hope that you found this video helpful on your cancer survivorship journey and empowers you to take control of your symptoms after radiation therapy. Please like this video if you found it helpful, and make sure you subscribe to my channel so you don't miss any new videos on pelvic health and oncology.